Cervical cancer is the only preventable women's cancer with vaccinations and screening programs. Cervical cancer has been shown to be caused by persistent HPV infection over many years, causing precancerous changes in the cervix that eventually lead to cervical cancer. Cervical cancer screening, or HPV screening, thus allows the earlier detection and treatment of precancer, preventing development of cervical cancer in future. Besides the pap smear test, HPV DNA testing is another screening method for cervical cancer and can be done via self-screening or physician sampling. HPV DNA is now the recommended primary screening for cervical cancer for all women who are aged between 30 to 69 years and due for your pap smear or HPV DNA test for cervical screening. You are due for cervical cancer screening if your last pap smear was 3 or more years ago, or last HPV test was 5 or more years ago. Women with the following exclusion criteria do not have to take this screening test: women who have never been sexually active, currently pregnant women, women who have undergone previous surgery to remove the uterus and cervix, or have previous history of cervical cancer. Currently menstruating women can take the screening test after her current menstruation cycle ends. The self-sampling HPV DNA test comprises women using a swab to obtain samples from their vagina. Patients report self-screening to be more convenient and less uncomfortable as compared to physician sampling. The accuracy of HPV DNA self-screening has also been shown in international and local studies to be comparable to sampling by doctors or physicians. The vaginal self-sampling swab is therefore safe and causes minimal discomfort. So, how do you do it? 1. Lower your underwear. Remove the white swab with cotton tip from its packaging. 2. Get into a comfortable position. Insert the swab into your vagina, aiming to insert the cotton tip in as far as possible. 3. Rotate the swab gently 3 times. Remove the swab. It should not hurt. 4. Unscrew the tube with the yellow top. Place the swab cotton tip down into the tube and break it off at the black line. 5. Screw the yellow top back on. Hand the completed swab back to your healthcare provider. The results of your HPV test will be disclosed to you by your healthcare provider. If your HPV results are negative, your next cervical cancer screening will be in 5 years from now. If your HPV results are positive for HPV strains other than HPV 16 and 18, you will be recalled to your healthcare provider for a pap smear. If your HPV results are positive for HPV strains 16 or 18, you will be recalled to a specialist gynecologist for colposcopy or a more thorough examination of your cervix. Thank you for watching this video. Cervical cancer screening saves lives. Please check in with your doctor on how to get a HPV DNA test kit. This video is presented by Yonglulin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.